My name's Elaine Mardis. I am the co-executive director of the Institute for Genomic Medicine at Nationwide Children's Hospital in Columbus, Ohio. So in pulling together the program for this year's AACR meeting, I think the hot topics largely focus on how the inclusion of various technologies is changing cancer research. One of the things that is a clear area of importance in cancer research that's very new is big data mining or big data interpretation. Another area that's really important in monitoring cancer patients and understanding their response to therapies is an area known as liquid biopsy. One of the reasons liquid biopsy is important to understand and study is because it's probably a much more effective, sensitive, and real-time way to understand how patients are responding to therapies. Another area that we really focused on in particular is the application of artificial intelligence to cancer data sets. Really a way of modeling cancer as a system and allowing us to use artificial intelligence to predict how specific cancers will respond to specific therapies. One of the areas that limits technologies like liquid biopsy from being immediately used in medical practice is that we have to do the appropriate studies to really understand, what does liquid biopsy tell us? How reliable is it? Is it a different method for different cancer types? And so on. And in particular, how does it compare to the standard of care, which is imaging? And so one of the things that gets explored at this meeting is different types of liquid biopsies. Do we want to look at circulating tumor cells, or circulating free DNA, or exosomes? There are many choices. I think the other thing from a technology standpoint is establishing the reproducibility of these methods, and this is also important for the use in medicine. So one of the big challenges of using big data mining approaches is really that we not only want to develop these methods, we also want to be able to package them effectively. What that means is that we want them to be essentially plug and play software pieces that any practitioner in a medical setting can use. How can I take a next generation data set from my patient's tumor, understand and interpret it in the context of how can I treat this patient the best way? And then once I've decided to make that treatment decision, how can I use the information to also monitor the patient and establish whether they're responding to the therapy or not responding to the therapy? So I think the big challenge in NGS and big data in particular is to integrate the data for each patient, compare that patient to other patients that are known in terms of their diagnosis and response, and really use that in a facile way as a medical practitioner on a day-to-day basis for every patient. We need to turn cancer into a chronic disease. I think the path to that is large data, interpretive algorithms, probably some machine learning based approaches that allow us to take each patient as an individual, compare that patient, their clinical data, their genomic data, and other data types to a very large database of other patients, and really use that approach to classify them. This then indicates to the physician what the right drugs are to use, how best to monitor the patient, what the likely symptoms or signs of therapeutic resistance are going to be. And once we have that model, then we can begin testing it in patients in a clinical trial-based approach. I think the easiest place to start actually may be in pediatric patients, because we often find that their disease is quite simple and straightforward. Monoclonal, very few mutations. The ones that we find are often very strong drivers. In about 50% of our patients, they're actually druggable drivers. So I think this sets an important early point where we might be able to start. And then if we're successful, we could move it into adult patients as well.
QIAGEN.
Sample to insight.